Ever wondered if what you've heard about dermal fillers is true? Let's bust 5 common myths together. First, what are dermal fillers? So dermal fillers are part of treatments that help erase wrinkles, reduce lost volume, and can be done to sculpt and contour the face. So let's go about doing it. Myth number 1, fillers give you a puffy face. Of course, anything which is done improperly can give you a poor outcome. And of course, fillers can definitely give you a puffy face if number 1 is overused or number 2 improperly administered. And therefore, you need to make sure that you choose a doctor who is experienced and understands facial anatomy. Also make sure that you communicate to your doctor your likes and your dislikes, and therefore your doctor would understand your aesthetic goals. When the doctor does the treatment, the doctor will be really careful and will use a conservative amount of filler, focusing on gradual enhancements rather than it being too much or overdone. We will tend to inject over areas whereby there is too little volume and making sure that we stay clear of places whereby the volume is excessive. And with all these measures and with a careful treatment, we should be able to give you subtle yet noticeable improvements in order to get a very good natural enhancement. Myth number 2, fillers are permanent. Well, yes, it's true that some fillers are permanent, but the truth is most dermal fillers are not. There are various kinds of fillers, but the most common fillers that we use are called hyaluronic acid fillers, and these last between 1 to 2 years, depending on brand, depending on the model that we use. While vast majority of treatments done by most doctors are good, if you do have some concerns with certain aspects of the treatment, for hyaluronic acid fillers, there is this medication called hyaluronidase that can be injected to make the hyaluronic acid fillers go away faster. There are also other kinds of fillers that we use, semi-permanent fillers that last in excess of 2 years, and even permanent fillers. But these are a little bit more subspecialized. Most fillers that we use is hyaluronic acid or HA fillers, and these are not permanent. Myth number 3, fillers are for wrinkles only. Well, certainly fillers are very useful for wrinkles. It's commonly applied over the forehead, the crow's feet area, the under eyes. However, its usage goes beyond just wrinkles. For anti-aging, sometimes we do have some volume loss, and fillers are very good for volume loss in order to give the face a more youthful look. For example, it can be done over the cheeks, the smile lines, and the marionette lines to give a more youthful appearance. Fillers can also be done for facial contouring. Very commonly, we have some sagginess of the cheeks and the jawline. Fillers over the chin, the cheeks, and the cheekbone area can give rise to a more V-shaped and well-contoured face.